Okay, so in the video yesterday I had mentioned that I wanted to show you how I do my home fluids. I'm sure it's different for everybody. Different doctors, different protocols. There's not always one set way to do something. I have a Broviac central line, so sorry, wrong side. So it goes in and it goes up, and this part goes down and around back into towards my heart, just to the top of the tip, like the tip where the chambers start. So what you need, obviously, is your NS. I already took the bag off, and as I'd mentioned yesterday, there could be some condensation and wetness, but as long as the bag has no holes or anything, there's no other, no obvious leaks or anything, it's normal. It's just the way they package it. So I do mine a bit differently when I hang stuff because I have trouble with my arms sometimes. So you need your tubing, which I took out of the bag, but I didn't take the paper off yet. So this is your just for gravity hanging tubing. It would be, depending on the machine you would use, it could be different. This can be used in one type of IV machine. This part would get pushed in, and that's what sets and stops it. On the pump, you need alcohol swabs, 3 of them, and that's it really. So you need to wash your hands beforehand, and then I've already done that, and just regular, any type of hand sanitizer. I prefer the ones that aren't scented when I do this, because I don't know, for some reason I feel like the scented ones, I don't know, I know they probably clean just as well, but it's just my personal preference. I use the scented ones when I'm out and stuff, but when I'm doing this, no. So what I like to start with first is this is the bottom of the bag here. So what you do is you have to take this little blue cap off, and you insert the top of this in. So the first thing you do before you do this, which is something I think you probably forget once and you never forget again. I did it once in nursing school and got one heck of a shower. It's kind of funny because I wasn't the only one in the class, and thankfully it was a lab and not with the patient. So you have to close the roller clamp. So you close it so it goes all the way down to the bottom, so that when you pierce your bag, it won't go straight through. Because if this is unclamped, it will go completely all the way through and come out the bottom before you need it. Once it's clamped, nothing will go through until you undo it. So I always keep the bag nearby because it's sterile inside, and I usually tuck this end in until I'm ready. Just because I want to keep it clean in case the cap would fall off, and plus sometimes I let some of the fluid run out. So what you do first is you pull this off, toss it, it's garbage. So you don't want to touch the inside of that. So you take the top off that, you don't need that anymore, and you pierce your bag. So you want to get it down to like where the thing ends, and then you hang it, if I can. This would be the one day I can. There we go. So this is your chamber that holds the fluids. You don't want to fill it up all the way, only about half. So usually 3 good squeezes is enough to get it to about half. So that's when I then make sure everything is untangled, because it's a pain to try to untangle when you're attached after. So I stick the end in the bag, and I'm really used to this, so I know that I won't usually get bubbles. The trick is to keep There's 2 of these along the line, so keep that upright when you're letting it fill. So there's this one. Usually if it's hanging down, you're okay. I'm high up to the, I'm still high up. Right now I have a hospital bed, so I put it up fairly high so I can reach everything, and then I go back down again. So I open the clamp, and it's going to be slower, so it slowly fills up, and I got a few bubbles in there, but they're little. In nursing school, they always say, you know, you don't want any bubbles in your tubing or whatever, but it would take an entire tube, which is about 23 cc's, to actually kill you. So I didn't do a great job of it for once when I'm actually filming it. So I don't know if you can see, but there's some little bubbles in there. But they don't matter because they're really tiny. But if they bother you, you hold it taut and they go away. They get caught in here. If you were to get a lot of bubbles, I mean, the bags are overfilled, so you can always just let more run out if it's a really big bubble. That's, you know, not fun. Anyway, so I've closed the roller clamp. Put that back on the bag. So now what I need to do is I open all 3 of them at the same time. That way I can just grab them. So I have 2. I'll do it in this one today because I used that one last time, and as I mentioned before, I like to alternate. So since this part has been hanging down my shirt all day, I like to make sure it's really clean. So I clean all around, I scrub the top, because that's where the, where's my 3rd one gone? Here it is. So then this one gets really cleaned up. There we go. Now my hands smell like alcohol. So then you have to take the top off of this, like the little blue cap. And you have to push it and then twist this on. Got a bit wet there. And it's in. Now, you have to unclamp, because you see it's clamped. This is closed. So, this is open. And then, just since I'm still high up, I'm going to lower myself a bit, because otherwise it will not flow very fast at all, since it's gravity. The lower you are, or the higher the bag, the faster the flow. And so the lower the bag, the slower the flow, which is a pain. Sometimes I forget, and then I lower myself, and I realize that I've just like bolused myself in like 45 minutes, which is fine. But so now I like to open the clamp up all the way, just to make sure that it's flowing. First of all, I can see it dripping in here, so I know it's running, but I can also feel it. It's like really, really, really cold, because my room is actually really cold right now because I haven't turned on our heat. So this is cold. And I don't count the drops anymore because I can kind of eyeball it and know how long it'll run for in 2 hours. And since I'm doing it at home, I can run it faster or slower, whatever I need. And so that's it. That's how you set up for your own fluids. As I said, different protocols for different types of lines, different, even, you know, every nurse has their own way of doing things. I'm a nurse, I'm also a patient. My home care nurses, when they change the dressing, they do, one does it one way, another one does it sort of another way. So, I mean, as long as it's sterile, or in this case, you know, sterile, cleaned up, you're fine, you know, no big deal. And basically you have to be really, really careful for infection. You don't want your line to ever get infected, because it can go septic and that can make you very sick, and some people do die from that. I had a friend who died from it, but she was fighting stage 4 cancer at the time, and she had no white blood cells left to fight, so she really didn't have a chance. But it just goes to show you that one little infection, one bug, one bacteria that can go in here can really get you. So you want to make sure when you do this, you wash your hands, you scrub the, your end. Just make sure that everything is done properly, and that if it's not you doing your own line, if it's your mom, your dad, a nurse, whoever, you want to make sure that they're doing it properly. And if you see them do it in a way you don't like, or in a way that doesn't look clean and safe, you stop them and you tell them, because it's your body, it's your health. You don't want it to go wrong. Another thing that I have to do, technically twice a week, my lines have to be flushed with NS. Since I do this twice a week, I don't need to flush it with NS. What I do is I usually use a little bit of whatever's in here, and I'll flush it in this line after. Just make sure you, again, clean this line, clean this 3 times, and then when you take this off, you don't let it touch anything, you just keep this part sterile and then just stick it on. Also, twice a week I have to flush it with, once a week I have to flush it with heparin. Some protocols stay for every day. It depends what you're using your line for. It really, the heparin keeps your line patent, it keeps it open. It's basically so you don't get a blood clot. I inject 2.5 cc's into my line. Mine come in syringes that look like this. This is just saline, but mine come in syringes that look like this from the pharmacy. They're pre-prepared and they need to go in the fridge. I also had some like this when they first sent me home. These have 3 cc's in them, so you have to unscrew the top. This is empty right now. You have to pull it down so you get all the air out, and then push it up. And then, go to your 2.5 mark. And then again, scrub it, clean it, and then put it in. So once a week I do that. Twice a week I make sure that the lines are flushed with the NS. And that's it. So far it's been going really well. I've had my line for about 6 weeks, maybe a little longer. 7 weeks maybe, and it's been a lifesaver to be able to do this at home when I need it, when I want it, not be reliant on a hospital appointment once a week at the clinic. I miss the clinic in a way. It sounds funny. I wanted to do this at home so bad because I was just I was tired of going there. But I do miss the social aspect. I made some good friends with the nurses and with a few of the patients. I'm still in contact with 2 of the patients, actually, through Facebook, so that's kind of fun. It's great. So I kind of miss the social aspect, but at the same time, this is way more comfortable. I can be in my own bed, I can be in my own room, I can read, I can knit, I can draw, I can watch TV, whereas when I was stuck at the day clinic, there was a TV in the room, but it was set to whatever, whoever got there first, basically. And it wasn't a really super comfortable place to be able to, read for 3 hours or, draw or whatever. It wasn't always comfortable, and it was quite cold, so at least here, right now my room is cold, so I'm going to throw on a pajama top because it's freezing. But yeah, so that's it. So I hope that this helped anybody who's wondering what it's like to get a central line. So again, if you have any comments or questions, feel free to put them down below, and I will answer them to the best of my ability. Thanks. Bye.